Okay, so this week we're going to talk about sources of public health data. Now, data is very widely available. There is a wealth of easily accessible information on health in the United States, and most of this is collected by governmental agencies like the Census, Health and Human Services, or NGOs, non government organizations like the American Red Cross, the American Cancer Society, and so forth. Now, in previous lectures, we've talked about death certificates, and let's just think about the data that's located on those. Now, death certificates contain a wide range of information about the person. It contains things like their gender, their race, their marital status, their address, the day that they were born, their actual age at death, and it includes the cause of death, the primary cause, and any secondary or contributing causes. So, for instance, if someone had pneumonia, they might also list the flu as a contributing cause. Now, we also collect data on all kinds of characteristics beyond demographics. So, we also collect things like drug use, or pollution levels, or the number of immunizations a person has, or whether or not someone uses a vape or cigarette, or what kind of foods that they eat. Because, for instance, if you eat French fries more than twice a week, that is considered an unhealthy lifestyle behavior. So it's also important to remember that the most up to date data that we have is on average 1 to 3 years behind the current year. So if we were looking for the most up to date data today, then we would probably at best find maybe 2021, 2022. So let's look at the most recent data on gun deaths. So as you can see, the most up-to-date current information that we have on gun mortality in the United States is from the year 2021. This means that we don't have information yet for 2022, and there's no rolling data set that lets us know what is going on as 2023 is progressing, even though we are in June. Now, one of the biggest sources of data that we use comes from the census. We are required by the Constitution of the United States to conduct a census every 10 years. Now, the primary purpose of this is to determine how many people we put in the House of Representatives, and we've done this every year or every 10 years since 1790. But the Department of the Census is a relatively new institution. We didn't establish this until 1902. So we don't really have data on births or deaths that are accurate prior to this date. Now, the census collects data on age, on gender, on race, on income, and education, as well as a wide range of other things such as the cost of mortgages in the areas that you live, the size of your home, your ancestry, and your income. So these types of data are stored by the census so that people who want to study how populations have changed can access this data and use it. Another big source of data for us is the National Vital Statistics Systems, which is part of the National Center of Health Statistics, which is part of Health and Human Services. Now, this compiles and publishes data on births, on deaths, on marriages, on divorces, and it even includes things like fetal deaths, like we talked about last week. Now, remember, this is only done for a fetus that is at least 20 weeks gestation. Prior to that, most states do not track a miscarriage or abortion that happens before 20 weeks, but we do track them starting at 20 weeks. So let's just take a quick look at a birth certificate. Similarly to the death certificate, there is a wide range of information that we collect. Most of this is on the parents. We collect data on who they are, their birth dates, their race, and then we collect things on the baby, the size, the head measurements, the time of birth, and weight. The National Statistics System also allows us to collect things like gestational age in the case of fetal deaths, the presence of adverse pediatric conditions such as spinal bifida, complications that may occur during pregnancy, such as endometriosis, any smoking use done by either parent, alcohol use done by either parent, drug use by either parent, or the use of vitamins by either parent. Remember, spina bifida can be easily treated by taking a vitamin called folic acid that we now have fortified in most foods. That was because of tracking these types of births and recognizing that certain vitamins were not being taken, and that had adverse pediatric conditions as a result. So let's talk about 3 different data sets that we commonly use in public health. The first is the Behavioral Risk Factor Surveillance System, or the BRFSS. Now, this is collected by the CDC in conjunction with all the health departments in the United States and in the majority of our territories, including Guam, the U.S. Virgin Islands, Puerto Rico, etc. It is collected every year, and it has, depending on the year, anywhere between 250,000 and 500,000 respondents. This has been in use since 1984, and it collects a wide range of behaviors such as how much fast food a person eats, how much exercise they get, how much they smoke and how much they drink, presence of a firearm, and so forth. The second data set that I'd like to talk about is the National Immunization Survey. Now, this is a group of phone surveys that's used to monitor vaccination coverage among children who are between 19 and 35 months, and then between teens who are 13 to 17. It also covers flu vaccinations for children who are 6 months to 17 years. Now, the National Immunization Survey has been used by numerous people, including myself, to look at vaccination rates among children, and specifically among teenagers. And this is what our paper on flu vaccination actually used as a data set, was the National Immunization Survey. What makes it unique is that it collects data from both the provider of the vaccination, so the doctor or the healthcare center, as well as the parents and guardians. Now, this survey is sponsored and conducted by the National Center for Immunization and Respiratory Diseases. It's a part of the Centers for Disease Control and Prevention, and it's authorized by the Public Health Service Act, specifically Sections 306. Now, the NIS was first begun back in April of 1994, and it was developed to check for vaccination coverage after a measles outbreak that occurred in the early 1990s. Now, the last one we'll talk about is the National Health and Nutritional Examination Survey, or NHANES. NHANES is a program of studies that's designed to assess the health and nutritional status of adults and children in the United States. Now, this survey is unique in that it combines interviews and physical examinations. Now, it began in the early 1960s, and it has been conducted as a series of surveys focusing on different population groups on different health topics. In 1999, the survey became a continuous program that has a changing focus on a variety of health and nutrition measurements to meet emerging needs, so looking at things that have changed in society like obesity. The survey examines a nationally representative sample of roughly about 5,000 persons each year. Now, these persons are located in communities across the country, 15 of which are visited each year. And it collects data on information including demographic, socioeconomic, dietary, and health-related questions. Okay, let's stop here.